50% of all heart attacks and strokes are caused, and I did say caused, by oral bacteria. What we also know is that of the people who died from the heart attack or stroke, 70% of the clot makeup was oral bacteria.
Katie Lee is an oral microbiome expert uncovering how mouth bacteria influence gut health, immunity, and brain function.
Reshaping our understanding of whole body wellness.
Can we just kind of like start unwrapping how the oral microbiome has this kind of link to the overarching conversation of dementia?
The oral microbiome affects brain health. When it causes inflammation, the body knows that something is going on, and the bacteria will actually cause the inside of our blood vessels to become sticky, to become weakened, but it also contributes to dementia because it restricts blood flow to the brain and thus oxygen.
So xylitol, I wouldn't naturally say as a nutritionist that these things are good or healthy for the gut microbiome, but actually you recommend it for oral health.
One of the hacks that you can do is actually start chewing xylitol gum. Xylitol kills those bad bacteria. It essentially starves them off.
With men and the oral microbiome, how is this affecting their fertility?
If you have a dysbiosis in your oral microbiome, you're 2.85 times more likely to have erectile dysfunction.
Wow.
We're swallowing about 1 billion bacteria a day in our saliva. Most of the people I test, 95 out of 100 have an issue. Our mouth is probably the dirtiest place on our body. So it's even a miracle that we have these things that are in there.
Firstly, I want to say thank you to tuning in and listening to the show. It means a huge amount. And connecting with all of you is something that I absolutely love as part of this journey of growing the show. One of my biggest goals of 2025 is doubling the reach of this show. And I can't do that without your support. So I would love to ask you a favor. If you can press subscribe or follow on whichever platform you listen to. This helps us reach more people. And for me, elevating women in science is so fundamental and ethical and scientific information. So if you feel the show empowers you and gives you the information that you've been seeking, I would love to ask a favor in return and to hit that subscribe button and help me reach the goal that I've set for the show of 2025. Thank you. Dr. Katie Lee, welcome to Live Well Be Well. I am very excited today because we are finally doing, after a very long time of trying to find the right person to bring onto this show, to talk about the oral microbiome. Now, we've all heard about the gut microbiome, but I have to say in the last probably 18 months, there's been a huge rise in conversations around the oral microbiome. And you actually were kind of at the forefront of that before it blew up, before Huberman did an episode on it back in 2024. And you released a book in 2023. So I'm very excited to deep dive into this because I think there's a lot of things that people will have no idea about when it comes to their oral microbiome and how interconnected it is to our overall health. So I'm going to start with a world fact that I found when I was reading your book, which is that our teeth are actually organs. Can you explain
Shocking.
that? People might not even think about that our teeth are organs.
A lot of people don't realize that, but our teeth are living things. They are organs. They have a blood supply. They have a nerve, so they have a nervous system, and they are actually connected to the rest of our body. And so a lot of people don't give teeth enough credit for what they do, but they have their own immune system. They can fight off attacks. And if you think about it, our mouth is probably the dirtiest place on our body, right? So it's even a miracle that we have these things that are in there, but they're tied to our nervous system. They are tied to our circulatory system. And so they're a crucial part to our overall health.
To be fair, I'm saying this isn't like I'm saying people just don't realize. I'll speak for myself personally. I'm so into health, but I didn't realize the impact that our microbiome in our mouth has on the rest of our health. And obviously it's the entryway, as you said, it's probably the dirtiest part of our bodies because it's the entry system, okay, into the rest of our bodies. But when we're looking at like our health in general, and we're going to go into it, but when I was looking through your book, it looks at heart disease, dementia, even fertility struggles.
Am I shocked? I would say no. I kind of blame dentists for this, to be honest, because, way back when dentistry was part of medicine and we had, even Hippocrates and Aristotle used to talk about the importance of oral health and how it relates to overall health and arthritis. Hippocrates, I think it was Hippocrates, either one, Hippocrates or Aristotle was talking about if you have arthritis or a gut issue, check your teeth. If you fix your teeth, those issues will resolve. So they even knew before Christ that our mouth was so important to our overall health. But then what happened was dentists started to pull away and tried to make their own kind of niche profession. And so we are responsible for taking the mouth out of the body and making it kind of a trade profession. And the first dental school in the US was actually in Baltimore. And so when we established the College of Dentistry at Baltimore, that was like the full-on division between dentists and physicians at that point. Because before then, we had some dentists that went down the barber route. So you could be a hairdresser and a dentist. So you could go get your hair done. Oh yeah, you haven't heard this story? This actually started in France. Yeah, it started in France where we had a division of dentists into barber surgeons and then dental surgeons. So the barbers would cut your hair and they had very sharp utensils. So then if you had a tooth problem, they could pull your tooth or pound amalgam into the teeth. That's where the silver fillings kind of came from. And then we had this separate group of dentists that were dental surgeons that really tried to study anatomy, different procedures that would prolong the life of the teeth. But we really didn't start to look at the microbiome of the mouth as being a reason for dental disease until right before the 1900s. Before that, actually, the first record of dentistry in the text was 5000 BC by the Sumerians, who actually said that dental disease was the result of toothworms. So we started out saying we have this microbial component, which, I mean, they're kind of true, right? And so 5000 BC, we have the Sumerians saying that there's a microbial component to oral health. We have Hippocrates and Aristotle saying that oral health, is important to systemic health. And then we kind of just messed it up for the next several centuries. And then it wasn't until, the 1900s or just before the 1900s that we started bringing things back to the microbiome. And so now there's this push of reconnecting the mouth to the rest of the body, which makes sense because the mouth, like you said, is the entryway to the body. But it also is the first stop of our digestive system. And so when you think about gut health, right, we have this long tube that goes mouth, end to end, tip to tip. And it's the same type of tissue that is in the mouth, that's lining our mouth, that lines our gut. And that tissue is supposed to act like a physical barrier. So like our skin. And it's supposed to keep what's on the outside and keep it from getting into our bloodstream. But we have this additional complication, which is we have these teeth that permeate through that tissue and create these little holes or areas of weakness where things from the mouth can get into the bloodstream. Now, we do have these tight junctions around our teeth, between our teeth and our gum tissue to wall that off. But when our microbiome is out of balance, those connections can break down, gums will start to bleed, and now we have a complete open door between our mouth and the rest of the body. So a lot of people don't realize that, but I'm really thankful for, Huberman did a podcast on this. Mark Hyman's even talked about the importance of oral health. So I'm just thankful for the platform and that they're getting the word out there.
I love that we're talking about this because I think before we even get to the next step, I love that you've just mentioned the gut microbiome and how the esophagus obviously links from like our beginning of our mouth all the way down into our GI tract. We've done so many conversations on the gut microbiome on this show, but let's just start off by what is the oral microbiome?
Yeah, so the oral microbiome is just a collection of all of the bacteria, viruses, fungi, kind of everything, all of the microbes that are in the mouth. And the majority of the microbiome is actually commensal or beneficial to our overall health. Only about 1% of what's in the oral microbiome is actually dangerous or pathologic to us, but we always want that to be in balance. And where we get in trouble is when that balance is disrupted between the good bugs and the bad bugs. And so think of the oral microbiome as kind of our immune, not kind of, it is our immune system to our mouth. And it is the immune system to the rest of the body. We know that there's certain species in the oral microbiome that will tag things coming into the mouth, tag them with like IgA antibodies to kind of alert the gut of, hey, this is coming down, this is bad. Fire up the immune system and take that bug away to keep us healthy. And so the microbiome is super critical to maintaining not only the health in our mouth, but the health in our gut and our overall body's health as well. There's about 754-ish different types of bacteria in the mouth, and we have about 2 billion of those bacteria in our mouth. So our mouth is full of stuff. Yes.
Wow. God, I'm now really concentrating on my mouth as you're talking about this and all the saliva. So we're going to go into the do's and don'ts of the microbiome, and we're going to go into next, like the body connections and how disease is interlinked. But I just really want to start with, what is the one thing that most people do every single day that you believe harms their oral microbiome? Let's just get that out there first. If there was like one thing that you just see commonly.
Oh gosh, there's so many things that people do to harm the oral microbiome. I would say one thing that people probably don't realize is harming their oral microbiome is how often they're eating. So every time that we eat, we have to start that digestive process because our mouth is part of our GI tract. And so we release saliva, and that saliva has enzymes in it that start to break down our food, like salivary amylase, which breaks down our carbohydrates. But what happens is when we eat, we release these enzymes, our mouth becomes acidic for a point in time, and that allows our food to start to break down. And when our mouth becomes acidic, and when we're putting things in our mouth, like, processed carbohydrates or sugars or things like that, every time that's going in, we're putting our mouth in a vulnerable state to where the bad pathogens in the mouth will flourish and to where we can actually lower the pH enough to cause tooth decay. And so a lot of people don't realize that the more frequently you're snacking, and I'm a snacker, so this is something that's always top of mind for me. I'm always a snacker.
All the people that are like, I eat little and often, are like, hating you right now.
I know. Well, that's how I was raised too, was, taste everything, eat nothing, right? Which obviously you're eating, but it's more of like grazing throughout the day instead of eating these big meals. It's how I was raised. So it's very difficult for me to actually, put it in my brain of like, hey, that's actually not okay for you to do. We have great products out there now that will help neutralize that acid and kind of starve off those bad pathogens. So there are ways that you can kind of biohack your way around it. But yeah, snacking is actually a big one that impacts oral health. A lot of times if I have someone come into the office and their oral hygiene is impeccable, they have little to no plaque or calculus on their teeth, their medical history is clear, meaning they don't have systemic issues, but they have a lot of dental disease.
Wow. And is it the same? I literally took a sip of water as you were explaining that. Is it the same for water? Does that impact it at all? So that's fine.
Water is fantastic. So sipping on water all day long is really, really good because it helps keep you hydrated. The more hydrated and lubricated your mouth is, the more protected your teeth and your oral microbiome are. So please have all the water possible.
Okay, great. It's so interesting because I don't want to label the term intermittent fasting because there's a lot of like conversations around that at the moment. But I think I don't label intermittent fasting as, finishing your dinner and waking up in the morning and having 8 hours of no food because you're generally asleep unless you're a nighttime snacker or a shift worker. But it's interesting because when we have kind of, the 8 to 12 hours break of finishing dinner and then having a breakfast, we know that's really beneficial for our gut microbiome. And as you're saying this, I'm thinking, well, that sounds very similar to the oral microbiome. So is there a lot of differences, is there a lot of similarities between what's good for our microbiome and what's good for our oral microbiome?
100%. It's the same thing. So what I like to say is the mouth is just a different stop on the bus route, right? And when we are born, we are essentially born sterile. When our mother's womb, there might be a little bit of bacteria in there, but if there's too much bacteria in the womb, that's when you can have things like miscarriages and stillbirths. So we want that womb space to be pretty much sterile. Our first introduction to bacteria is actually coming through the birth canal, which is why it's so important to have vaginal births. We also get microbiome through the breast, but when you come out, your mouth is sterile. So everything that we have in our mouth in terms of our microbiome, we have acquired from our environment and the people around us. And so there is a direct overlap, about 45 to 50% overlap between the oral microbiome and the gut microbiome. And that makes sense because we're swallowing about 1 billion bacteria a day in our saliva. Now, most of that bacteria is going to be eradicated in the stomach because of the stomach acid. The bacteria that cause harm that are from the mouth that get to the rest of the body do so because they enter our bloodstream through our gum tissue. And so those are the ones that we really need to watch out for. But in general, health and lifestyle practices that are great for your gut microbiome are great for your oral microbiome. And further, everyone is really interested in leaky gut. Everyone wants to heal their leaky gut. The same enzyme that breaks down your gut lining that causes leaky gut is the same enzyme that breaks down your gum tissue that causes bleeding gums, gingivitis, and periodontal disease. It's the same enzyme because it's the same tissue. The tissue in your mouth is the same tissue that's in your gut lining. The gut lining is just thinner. It's one cellular layer versus your mouth has multiple layers, but it's the same tissue. It's the same system.
It's so fascinating. And like for anyone that doesn't know what leaky gut is, it's obviously when your kind of intestinal wall becomes more impermeable. So you basically allow things that shouldn't be going outside of the gut wall kind of going into the bloodstream, and it kind of can give you some really poor gut issues. And I'm guessing that's the same within the mouth and the teeth.
Same.
Where with the gum, and it's becoming more impermeable. So there's things that are crossing outside that shouldn't be. I mean, it's so fascinating. So the one thing that I want to mention, which does surprise me, that I know isn't good for our gut, but I read in your book that it's good as a hack post maybe eating, because we just spoke about snacking and you said, but there are some hacks. So Xylitol, am I saying that correctly? Like Xylitol, chewing gum? Yeah. So I know that, I wouldn't naturally say as a nutritionist that these things are good or healthy for the gut microbiome, but actually you recommend it for oral health, potentially like within a chewing gum or maybe post snacking, as you said, as one of the hacks. Why is that good for our oral microbiome?
Yeah. So you're absolutely right that a bunch of xylitol will cause a lot of GI distress because we can't really digest it. I'm not a nutritionist, you are, but it definitely causes
a good team.
Yeah, it definitely causes a lot of GI distress. I know that if I eat, like I love sweets too. So I love snacking and I love sweets, right? And I'm a dentist, but sometimes I'll have sweets that are sweetened with xylitol instead of sugar. And if I have more than one, I can definitely sense it in my gut, which is kind of nice because it kind of keeps you from having more than one. But yes, so after you eat, as I mentioned, the pH in our mouth drops naturally because we're trying to start digesting the food. Plus, what we oftentimes put in our mouth is acidic, and so that will lower our pH. And our saliva has a buffering capacity, or these proteins in there that will work really hard to bring our pH back up to neutral so that we're not in a constant state of demineralization. But when we turn our mouth acidic, plus, we're putting in things that feed bad bacteria, such as starches, carbohydrates, and sugar. That causes the oral microbiome to start to flourish. So one of the hacks that you can do is actually start chewing xylitol gum. Xylitol kills those bad bacteria. It essentially starves them off. And so the bacteria are looking for sugars, the bad bacteria are looking for sugars to eat, so that way they can, lay out more acid excrement on the teeth. It also causes them to grow and proliferate. So if you put something else in there like xylitol, that's going to cause those bacteria to die off. The other thing about chewing is that anytime you chew, you're releasing saliva because your brain is saying, oh, we're chewing something, we need to get ready for digestion. So it releases more saliva, and that helps. Saliva always neutralizes the pH. It helps coat your teeth and protect them from kind of bacterial invasion. So xylitol gum is really, really good. Now, what I like about xylitol gum is very little of that xylitol is actually getting into your system if you're just chewing it, which is really nice versus if you're eating, like a candy that's been sweetened with xylitol. So xylitol gum is good. It's also good for people who have drier mouths or who are on medications and can't produce a lot of saliva. I usually will recommend that they choose xylitol gum. Now, there's other products out there now. You can actually do some mouth sprays that will neutralize the pH in your mouth. And there's a product that I love called Daily Dental Cares. They have two products. One is called Phosphidin and one is called Protectin. They're actually lozenges that you can pop in your mouth after you're eating or snacking. And it is a kind of a concoction of vitamins, but putting them together, those vitamins starve off the bad bacteria, kind of like what xylitol does, except that there's no xylitol in this product. So it changes the pH, or it changes the environment of the mouth to make it more of like a ketogenic environment. And so the bad pathogens can only survive by eating sugar. So those die off. The commensal pathogens then start to thrive because they can survive in an environment like this. And so you can rebalance the microbiome very quickly by just popping in one of these meds after you eat or snack.
I've spent years in the fashion industry, but also years as a scientist, trying to understand how our bodies are meant to move. And I'll be honest with you, most shoes are terrible for our feet. I know this firsthand. For years, I wore the wrong shoes, ones that looked great, but in reality gave me persistent back pain and messed up toenails. I searched everywhere for a pair of shoes that wouldn't just support my feet, but would also help them heal. And I struggled because most healthy shoes don't exactly scream style. And then I found Vivo Barefoot, something that finally looks good and actually works. I wear mine with cargo pants, awesome leather trousers, a crisp white tee, and my favorite sunnies. Not only do they feel great, but they really fit my style. Wide, thin, and flexible, these shoes allow my feet to move naturally the way they're supposed to. And the best part, just 6 months of barefoot shoes can increase your foot strength by 60%, helping to undo the years of damage from conventional footwear. Now, if you've ever had the same problem and tried to find a shoe that supports your body without sacrificing style, then this is it. Try Vivo Barefoot for yourself and feel the difference. You can get 20% off if you use the code LWBW20 at vivobarefoot.com, where the T's and C's apply. Trust me, your feet, your back, and your outfit will thank you.
Wow, I love these hacks. I mean, I have so many products here, but so many I've literally bought since reading your book this morning. So many different products, and we're going to go on to what those are. I think Amazon have just got like a huge order from me
I know.
on different things that
I need. Everyone says like, can you make a store, right? That we could go on and just. I need to do that. Yeah.
And I want to get into these so our listeners can have that. And maybe we'll put them in the show notes, so people can kind of click on them. And there's no like affiliation with that I have with any of these products, just so we're really clear. But I just didn't realize that, you know, how important certain products were and how damaging others were as well. So we're going to get onto that. But before, I really don't want to skip the connection between our oral microbiome and our health. And I know that you really opened up in the 5 questions to nourish your mind, body, and soul on our compassionate cure. And one of the things that you spoke about was like your fertility journey and how much, you know, it's been a really hard journey for you to get there. Something that I'm seeing hugely is not just in women struggling to conceive, but it is in men's sperm quality and men being more infertile than ever before. And so it's huge. You know, people are having less children for a variety of reasons, but then actually people that are wanting to have children are struggling, really struggling. And it's not just the women. So when I was reading your book, I was really surprised. What is the connection here? Let's start with men, because I think maybe they are ones that don't get enough airtime at the moment with this because it's quite a new area. But with men and the oral microbiome, how is this affecting their fertility? Like if anyone's maybe listening and struggling, this might be one area that they've not thought about.
I love that you're bringing this up and that we're starting with the men, because so often in being a patient who's gone through fertility treatment, the focus is always on the woman of, you know, something is wrong with you and your reproductive system and this is all your fault and you need to be optimized. But what we know from science is that 50% of all infertility arises in the man. So it's equal people's responsibility in terms of trying to have this kid. And it takes 2 to make a child, right? And so what we do know and what you mentioned is that sperm quality and quantity have really gone down. And this is a whole host of reasons why, but one of the contributing factors is oral microbiome. And so what we know is that if people have an infection in their mouth, that bacteria will actually get into the bloodstream and get into the sperm and infect the sperm. So men oftentimes will have, it's hard to say this word, but bacterial spermeremia, which is bacteria in the sperm. So their sperm will be infected. And that can actually reduce the quantity of sperm that they have. It will reduce their ability to swim. So they'll have, you know, some men will say, I have slow swimmers. Oftentimes that is related to the mouth, to the oral microbiome, or it'll change the shape of the head of the sperm, making it less likely to penetrate the egg and make an embryo. And so you can have that if you have a dysbiosis in the oral microbiome. That could be one cause of this. The other thing that can happen is that men oftentimes will suffer from erectile dysfunction. So if men have an infection of PG in their mouth, which is a specific bacteria, Porphyromonas gingivalis, that bacteria will actually decrease arginine production. And arginine is a precursor to nitric oxide. And nitric oxide is a very potent vasodilator, and you need vasodilation in order to achieve an erection. So a lot of times men will come in and they really don't care at all about oral microbiome and what I'm talking to them about. But as soon as I say, if you have a dysbiosis in your oral microbiome, you're 2.85 times more likely to have erectile dysfunction. All of a sudden, they're perking up, they're leaning in, they're asking more questions, because it will change the amount, shape, and swimming ability of sperm, but also impact their ability to achieve an erection. And if you don't get an erection, you can't have a baby.
Wow. I mean, I think anyone listening to this now is going to perk up, especially as soon as something turns in with sex organs. Everyone wants to know. And actually, the person who wrote your book, your foreword for your book, Dr. Victoria Sampson, who's getting a lot of airtime at the moment, I heard that she wrote a stat, or she said a stat around that she talked about a study which looked at sub-fertile men, and 90% of them had a dental disease or an infection. And they split them into two groups. And one group had treatment for obviously the oral disease or infection. And the ones that had treatment saw a 70% improvement in their sperm quality and pregnancy rates. Like, that overall just blew my mind. And you've just given that an incredible explanation as to why. But I think when even like hearing that stat, 70%, it's so interesting that there's not a connection with fertility doctors and having this conversation, because I think, we'll talk about stress, we'll talk about, food and diet and maybe reducing your alcohol to help sperm quality. But I don't think I've ever heard anyone talk about the oral microbiome.
No, they don't even really talk about oral microbiome for women and improving their chances of conception either. And I was a fertility patient for 6 years at two of the top reproductive endocrinologist clinics in America. And none of them asked me about my oral health, not once, even though I was having these failed pregnancies or miscarriages. Never once asked me about my oral microbiome. And that's kind of what kind of dove me into, well, what else could be, contributing to this? But it's critically important.
How does it affect the women? So we've just spoke about the men. How does a woman's oral microbiome affect female fertility and pregnancy? Yeah.
So, I could do a whole day course on this. So try and actually, I do have an online course about this. It is affecting the entire journey. So, it affects women's ability to ovulate. It affects their ability to have the embryo implant. It affects the ability to maintain the pregnancy. It affects miscarriage and stillbirth rates. It affects preterm labor and low birth weight babies. And it also increases risk of having gestational diabetes and preeclampsia. So the whole gamut of women's health, which is why in my new clinic, we have a whole department of my new clinic devoted to women's health. This is how passionate I am about this topic, because the oral microbiome affects every step of that way. And what I tell women is whether or not you want to have a baby, you're still a woman and you still are entitled to optimal health. And unfortunately, in the world we live in, women's health is severely neglected. A lot of times, women's health recommendations are based off of being a small man, right? They do studies on men and then they say women are just smaller versions of men. And so
Dr. Stacey Sims.
Yes, this could be the this is what we'll recommend for women, but we are completely biologically and physiologically different than men. And so we need to have people dedicated to women, because even if you don't have a child, you could be afflicted with things like PCOS and endometriosis, which, by the way, there was a study that came out in 2023 stating that 64% of all endometriosis cases were contributed to oral FN, Fusobacterium nucleatum. Oral bacteria causing FN, or not causing, oral bacteria were found in 64% of endometriosis cases in the tissue.
Wow.
Wild.
That's huge.
And in my book, I talk about this, and I wrote my book before the study came out, but I had a patient that came in and she was young, healthy, no systemic health issues. But when we did her exam, her gums, she was bleeding like a stuck pig. That is one of the things we say in the US when someone has a bleeding gum. She was bleeding like a stuck pig. And my hygienist came and got me right away and said, hey, I think something else is going on. So we did a microbiome test. Her FN was off the chart. We treated her pretty aggressively, had her come back in 3 months, tested her again. Her FN was down and her clinical presentation was improved, but it still something didn't look right. So I sent her to her primary care doctor and they did some tests and they found out she had systemic endometriosis. She had lesions in her lungs. And if we wouldn't have tested,
my gosh.
And we sent her saliva test to her doctor, of course, but if we wouldn't have tested, we would have never known. And she actually came back and worked for me at one of my remote clinics because she said that we saved her life. And so she wanted to
basically did.
She wanted to be part of something like that was able to help other people. So that was pretty powerful. But yeah, so even if you don't want to have a baby, there's, our reproductive system is the essence, right, of being a woman. And so anything that we can do to make sure that that's healthy and optimize that is what we want to do.
So people are probably listening to this going, oh my gosh, I have no idea about my oral microbiome. Before I kind of leave the fertility section, how can one person, because I go to the dentist every year and I have 2 hygienist appointments, but I don't think I've ever spoken about this stuff. How can we understand the quality of our oral microbiome and where we're at? Because I know many dentists that will openly ask to be testing your oral microbiome. So this now for many people going, wow, this is a whole new area I've never thought about, but how do I figure this out?
So I always tell people they need to get a test. And so the best way to get your hands on the test is to ask your dentist if they do this type of test. Dentists do not need any sort of special certification to be able to order this test for you. And so I would call your dentist, see if they do a test. In the UK, Victoria Sampson, she's kind of the guru of this. She has a clinic in, I think is it Wayfair, London? Or Mayfair?
Yeah.
Wayfair?
Mayfair. She has it in, near Harley Street, basically.
Yeah. Yep. So she does this testing at her office. And then there's other providers throughout the US that will do this. I currently have a telehealth service where people can book with me. I can ship them a test to their house and do a saliva test for them. And then we can go over the results and create a care plan that involves both dental treatment, but also supplementation, nutrition, and lifestyle. And we can work with their current dentist to get them the care that they need, because there just isn't a whole lot of this out on the market yet. Dr. Victoria and myself and so many others are trying to spread the word to make this more widestream practice. But just like you can go and get a GI test, right? You can do GI tests basically anywhere right now. You should be able to do an oral microbiome test as well. So we're really pushing to try and get that to be more mainstream, because you don't know what's going on. I would say most of the people I test, 9 out of 10, 90 out of 100, 95 out of 100 have an issue. And they don't even know it. A lot of them don't have symptoms, or they have symptoms, but they're unaware that they're actually symptoms of an issue.
Let me tell you about OneSkin and why I'm genuinely fascinated by what they're doing. Founded by all-women team scientists, OneSkin is a skincare brand that's redefining how we age. And you can get 15% off your first order using code LWBW. What's caught my attention is their groundbreaking approach to skin health at a cellular level. Instead of masking the signs of aging, OneSkin tackles the problem at its root with its No.1 peptide. Here's how it works. As we age, our skin accumulates senescent cells, or zombie cells, that speed up aging in healthy cells, causing wrinkles and loss of elasticity. OneSkin's OS01 peptide is scientifically proven to target these cells, reversing your skin's biological age for healthier, more resilient skin. This isn't about chasing eternal youth. It's about maintaining a strong, healthy skin at any age. And since your skin is the body's largest organ, keeping it healthy is key to your overall well-being. So if you want to see what the science of longevity can do for your skin, visit oneskin.co/LWBW and use code LWBW for 15% off your first order. Yeah, well, this is the first time in over, 350 episodes we're having a conversation on the oral microbiome. But even just for myself as a scientist and a host of the show, I've never really I know I've got to clean my teeth twice a day and floss. I sometimes floss, I sometimes don't, depends how I feel, even though I've been told. But I've never really had an education on it. And so for me, this is kind of the first time I'm really educating myself around this topic, which Now I'm realizing it's becoming huge. So we're gonna like lead on again to the things with food and diet and stress and lifestyle, and also like the products that we should be using. But I really don't want to skip over a couple more things because there's a lot more than just fertility, but I started there because it felt so prominent in today's society. But we do a lot of conversations around brain health and Alzheimer's and dementia is the leading cause of death here in the UK. And I was really surprised that there was a whole chapter on Alzheimer's and brain health and the connection. Even looking at like the herpes virus and cold sores, and which is known as like the kissing disease, and that there's a connection between neurodegenerative diseases. Like all of this really blew my mind. So can we just kind of like start unwrapping how the oral microbiome has this kind of link to the overarching conversation of dementia?
Yeah. And what I can do is maybe start by explaining how these bacteria get into the body. So as I mentioned, we have our oral microbiome. Our mouth is lined by tissue, and that tissue's job is the same as our skin, which is to keep the environment on the outside and keep things from getting into our bloodstream. But what happens is when we have a dysbiosis in our microbiome, our body senses that there's an infection that shouldn't be there. So it's going to release our white blood cells and our immune modulators to go and try and kill whatever is invading. And ahead of those cells, the body will release AMP8, which is that enzyme I talked about that's responsible for breaking down the gut tissue. That enzyme acts as a scissor. So it goes and it starts cutting through any collagen that's in the body to allow those cells direct access to the invasion. And so that enzyme will start to cut through our gum tissue and make our gums permeable. So instead of our gums being a physical barrier, now they microscopically become permeable, kind of like a sponge. And so now it's letting the cells get to the source of infection, but at the same time, that gum tissue can no longer act as a barrier. Now that bacteria get into the gum tissue, and our gum tissue is what houses the blood supply of our body. That's why some people's gums are bleeding when they brush or floss. And so when we see our gums are bleeding, that should be an aha warning sign that our gums are leaky. We have leaky gums. And so once those pathogens get into the gum tissue, they can circulate anywhere and everywhere throughout the body. And one of the places that they go, and that's very close to the mouth, is the brain. And so we have the blood-brain barrier, which is a semi-permeable membrane that's supposed to let certain things into the brain that we need, but also keep out things that's going to harm our bodies. So it should be keeping out pathogens, bad bacteria. You know, sometimes people will talk about parasites in the brain, toxins, things like that. Microplastics. But when the blood-brain barrier can be broken down as well. So things like stress, chronic inflammation, glucose disruption in our bodies, those things will break down the blood-brain barrier. And now that can no longer protect our brain. So it opens the doors for oral bacteria to get into the brain, and the brain knows these bacteria are not supposed to be here. And so what happens in the case of Alzheimer's is the brain starts laying down beta amyloid plaques around the neurons to protect them from that bacteria. But in doing so, starves the brain off from critical nutrients that it needs. And then those neurons start to shrink and die off. So the brain is trying to save itself, right? But in essence, it's killing itself at the same time. So that's one way the bacteria will directly cause those beta amyloid or contribute to those beta amyloid plaques laying down. It also disrupts tau protein formation, which we know is getting even more important in Alzheimer's. But the other way that the oral microbiome affects brain health is when it causes inflammation. Again, the body knows that something is going on. It's out of whack. So we elicit this chronic inflammatory response, and the bacteria will actually cause the inside of our blood vessels to become sticky, to become weakened, to lose their elasticity in terms of dilating and contracting. And over time, that will reduce blood flow. So we'll actually get reduction of blood flow to the brain, which we need blood flow in the brain because that's how our brain gets oxygen and the nutrients it needs. So it'll contribute to Alzheimer's by those beta amyloid plaques and tau protein disruption, but it also contributes to dementia because it restricts blood flow to the brain and thus oxygen. So 2 ways that it affects brain health.
If people don't start flossing their teeth after this episode, I don't know what's going to make them floss. I feel like this is the information that dentists should be relaying to us when we're in the chair.
Well, and you bring up such a critical thing, which is flossing. So flossing is so important. We have a saying in dentistry that's not widely known, but it's you only floss the teeth you want to keep. So if you look at your teeth, in between your teeth is where you have your gum tissue. You have the pointy triangle of tissue called the papilla. The papilla is where the blood vessels are. So the two most important areas of your teeth to clean are in between your teeth because that's where the blood supply is. That's the connection to the body. So when you're brushing your teeth, you're only cleaning the 3 out of 5 surfaces of your teeth, and you're missing the 2 most critical that are attached to the rest of the body. So if you're going to do anything at night, let's say you only have time or energy for one of the 2, in my opinion, floss, because that's what's cleaning and keeping the barrier intact between your mouth and the rest of the body.
Wow. Do you know what? I always cite this one study, which shows, it shows association, not causation. But now I'm like, maybe it does. There's a study that shows that people that floss their teeth on average live 8 years longer. And I always give that.
Whoa.
I always give this kind of analogy because I'm like, is it that they're flossing or is it the fact that they're just much more health conscious people?
Health conscious, yeah.
And obviously they kind of make these different kind of implementations in their life to make sure that they're looking after their health. But there's definitely something to do with them flossing their teeth that is also helping.
Either way, it's
longer.
Good, right?
Either way, it's good. Now this is all falling into place.
Yeah. Well, and bringing it back to brain health too, there's a lot of research out there showing that if the number of teeth that you have, and not just number, but number of pairs of teeth, so having a tooth on top and a tooth on bottom that meet up, if you can maintain at least 10 pairs of teeth, that adds, I want to say it's like 7 or 8 years to your life as well. And I have the stat in the book, but the number of pairs of teeth are critically important. So it's always important as dentists that we help maintain teeth, but if someone loses teeth, to replace that tooth. And that comes down to being able to chew nutritious foods, right? Because the more teeth you're losing, the less likely or less able you are to eat very fibrous, nutrient-dense foods, and you're more likely to go to those uber-processed soft foods that we know spike our blood sugar and then cause us to have diabetes of the brain. So very important.
Lovely type 3 diabetes that we hear about a lot. Well, this basically leads me on to one of my favorite quotes in your book, which is the quickest way to a man's health. The quickest way to a man's heart is through his mouth. Literally, the link between heart disease and oral microbiome. People might be shocked by this. I mean, I was quite shocked reading this. What is the kind of connection here between, cardiovascular disease and heart disease with your oral microbiome?
Yeah, so this is what I think gets the most attention in terms of oral microbiome and systemic health is the link between heart disease and oral microbiome dysbiosis. So same thing or very similar to the brain. So we have a bacterial component where we have specific bacteria in the mouth that directly impact heart health. And then we also have the systemic vascular inflammation that reduces blood vessels. Or blood flow. So what we know is that 50% of all heart attacks and strokes are caused, and I did say caused, by oral bacteria. What we also know is that of the people who died from the heart attack or stroke, they took that blood clot and they analyzed the blood clots to see what made them up. 70% of the clot makeup was oral bacteria. So they have the clot, 70% of the clot makeup was oral bacteria. So not only do bacteria pathogens from the mouth cause heart attacks and strokes, but they also make them more deadly. And so what happens is we get the bacteria into our bloodstream, which I've already explained how that happens. But the bacteria basically elicit an inflammatory response in our blood vessels, and they will accelerate plaque formation. So it causes these contributes to and accelerates the plaque buildup that's inside of our vessels. Those plaques will then attach to the vessel wall, which the oral bacteria make the inside of our blood vessels become stickier. So instead of them being nice, smooth, tubes, if you will, that blood can freely flow through. When we have that oral bacteria in our blood vessels, it makes the vessels a lot stickier. So those plaques are more prone to stick. And when those plaques stick to the vessel wall, it actually weakens that vessel wall. And I always make this joke. It's kind of like when you're driving your car and you hit a curb, how you'll get like a little bubble on the wall of your tire that makes it very hard to repair. You can't repair that, but it makes the tire more prone to blow. So same thing. Once that plaque attaches to the vessel wall, it weakens that wall. And then if you have a very acute bout of inflammation that oftentimes is coming from the mouth, that will cause that plaque to dislodge. When it dislodges, it rips that vessel, and then the body will send clotting factors to repair that rip, and those clotting factors will then occlude the blood vessel, and that's what causes the heart attack and stroke. So it's not necessarily the plaque itself that's an occlusion of the blood vessel. It's the acute bout of inflammation that's causing the tear and the repair that causes the heart attacks and strokes.
That's made me like really stop in my tracks. 50%.
Yeah, 50%.
Is caused
Yep.
by by poor oral microbiome.
Yeah. There's a great book out there called Beat the Heart Attack Gene by Bradley Bale and Amy Doneen. And I read their book maybe circa 2012, 2013. They have a whole chapter in there devoted to oral health. And that was really the first time I saw the medical community really acknowledging the fact that oral health plays such a crucial role in cardiovascular health or systemic health. But they have a whole chapter in there saying, if you have heart attack in your family, heart disease and heart attacks in your family, part of your care plan should be your dentist, because they should be also keeping the inflammation in your mouth down and also making sure that there's certain pathogens not present in the mouth, because we know that certain pathogens, they increase LDL circulation, they decrease HDL, they increase inflammatory processes in the body, they decrease the vessel's ability to expand and contract. There's all sorts of things that the oral microbiome does.
I mean, this should definitely be on the American guidelines, because this is your biggest killer, is cardiovascular disease. I mean, in the UK, we're dementia, and in the US, you guys are cardiovascular disease. I mean, there's both a big connection. But if there's a 50%, if there's a 50% reason of why this is happening is due to the oral microbiome, that should be a public health message.
It should be, and it's not. I will tell you that. And actually, the correlation between bugs in the mouth and heart disease and heart attacks is even stronger when someone has a root canal abscess. So root canal abscesses are actually much harder on the heart and much deadlier than just having periopathogens or gum pathogens. And so a lot of times people will say, oh, I've had a root canal, on my x-ray, I have a little abscess or cyst, but it's not changing in size. I don't feel any pain. Therefore, I'm not going to treat it. And even doctors will say, we don't recommend treating this. It's not growing. You're not having symptoms. We'll just watch it over time. But what we know is that those bacteria inside that endodontic abscess are actually way more deadly and dangerous for the heart than periodontal pathogens are.
Okay, if anyone has an abscess, please go and get it.
Yes,
sorted.
Please, just because you don't have pain doesn't mean it's deadly, right? Same with heart disease. Most often, people don't know that they have heart disease or high blood pressure issue because there's no symptoms. Oftentimes, their first symptom is like, boom, a heart attack, right? Or AFib, and it's too late.
So the other thing that I have to mention here, I mean, there's so many things within your book which is connected to health, but it's also cancer. And, everyone listening to this will have had someone that they love affected with cancer. And it's becoming more and more prominent in our society. There's a lot of different cancers that we can talk about, whether it's mouth cancer or colon cancer. But what is kind of the links here? What's the most prominent to be aware of? How can we look at physical signs and symptoms to be aware that we might be having cancer growth inside of us?
I think the biggest thing to note is that cancer, by and large, is not a genetic disease. Sure, there are some cancers that are directly linked to genetic mutations. We know this. There's certain types of breast cancer and what have you that are linked to genetic mutations. But by and large, we know that cancers are caused by epigenetics, by our environment, by toxins, and the big thing is by inflammation. And so it's everyone's job or duty to make sure that they're lessening their systemic chronic inflammatory burden as much as possible. The more inflammation you can reduce in your body, the healthier you'll be. You'll have less arthritis, you'll have less gut issues, less oral issues, less brain fog. And so really the oral microbiome, sure, there are some direct bacterial links to cancer, like you mentioned, FN and colon cancer. That's a really big one that has come out recently after 2020. We know that FN is directly linked to colon cancer. It burrows inside colon cancer polyps, gets to the center of those polyps and makes them more difficult to treat, more resistant to treatment. And patients that have FN-associated colon cancers have worse outcomes and greater chances of metastasis. So there are certain situations like that where we know specific oral bacteria can lead to or contribute to cancers. Another big one is pancreatic cancer. We know that certain bacteria in the mouth puts you at a 62% increased risk of pancreatic cancer. And pancreatic cancer is a devastating disease because it's oftentimes caught in the late stages. And so the 5-year survival rate, I believe, is only 8%. Just a nasty, nasty one. So yeah, it's all about, keep your oral microbiome in check, lessen your systemic inflammatory burden, and then also keep certain pathogens as low as possible or eliminated completely to reduce your risk of cancer.
It's huge, isn't it? I just kind of hearing through, and you also talk a lot about diabetes and how sometimes when someone sits in your chair in front of you, you can automatically tell that they are pre-diabetic or diabetic. Like, what is it in their mouth that is showing symptoms that somebody might be pre-diabetic or diabetic? And I guess this is probably important for even pregnant women, right, who might have gestational diabetes, because I learned from Chris Palmer, who came into the show, that women that have gestational diabetes have a higher risk of having a child that has autism. And that is what my sister had.
Ooh, no, I did not know that.
Yeah, it's a really, really big thing. Yeah, it's a real metabolic problem that we don't look about as much. So let's understand how can we look in our mouth and figure out whether this is maybe a cause of concern.
Yeah. So most often I would say looking at someone's mouth, we're definitely more likely to catch someone who has undiagnosed diabetes than pre-diabetes. If someone has pre-diabetes, they're usually on that spectrum for about 10 years before they qualify for the diagnosis of diabetes, which is good because you have 10 years that you can, kind of jump in and do some lifestyle modifications and things like that to kind of reverse that disease process. But usually what I'll see in my chair is a diabetic who doesn't know that they're diabetic. And so some signs and symptoms that we'll see is they'll have a very dry mouth. They're constantly drinking water, but their mouth is never moistened. And so what happens is they get real sticky tissues. So when they talk, you'll kind of hear kind of like things are stuck. So they'll have significant dry mouth. We'll also see, because they have no saliva is meant to bathe our teeth and kind of provide kind of a barrier between the tooth and the bacteria attaching to the tooth to keep us from getting tooth decay. Saliva also helps us remineralize our teeth. So without that saliva, oftentimes we'll see diabetics that have a lot of tooth decay along the gum line, because that's typically where saliva should be. And if it's not, that's where our plaque accumulates, is along the gum line, which is why when we say brush our teeth, we really mean brush your gums, brush the junction between your teeth and your gums to try and brush off that plaque. And so we'll see a lot of cavities at the gum line. Their tissues oftentimes will appear very pale instead of pink. Sometimes they can have like a bald or glossy tongue, so their tongue looks really smooth. And then sometimes we'll also see something called angular cheilitis, which is where they'll have these little sores on the corners of their mouth that are kind of moist and sticky. But they're kind of like at the angles of the mouth there. We'll see that. And sometimes those sores can have a little bit of fungus on them, or they can have a little bit of fungus or candida in their mouth as well.
Wow. Okay. So there's a lot there for people to take in. Is bad breath one of the things that could be? Because I think that feels like quite a simple symptom to me in my mind, but I don't know if that's kind of a symptom to be aware of. But for me, if anyone's on the ketogenic diet, they'll have the ketones will give them a very bad breath. But bad breath in general, is that a symptom to be aware of, that you've got poor oral health?
Yes, it certainly should be alarming that something is going on, unless you're doing something like keto where you're intentionally doing something to change the biochemistry of your body. But diabetics, if they have a really poorly controlled blood glucose, oftentimes they'll have a sweet smell to their breath. Their breath will actually smell sweet. Or what can happen is because they have no saliva, whenever you have a dry mouth, that really creates an environment for the bad pathogens to proliferate. So oftentimes they will have bad breath just because they have dry mouth. So oftentimes people with dry mouth will have a microbiome dysbiosis because of that. Bad breath can also be an indicator of acid reflux. That's a really big one that a lot of people don't realize, is that you can have acid reflux, and sometimes it's contributed to sleep apnea at night. So if someone is grinding their teeth, or if they're mouth breathing, or if they're suffering from some sort of airway issue like sleep apnea at night, oftentimes they'll have acid reflux, and that acid reflux can cause people to have bad breath. So usually, if someone has bad breath, I look at their microbiome first, because I'm like, okay, some bacteria are causing sulfur here. We need to see what's there, try and fix that. If that comes back negative, then I oftentimes will go look at acid reflux to see if that's contributing to the bad breath. I'll look at dry mouth. That's another big one. Most tonsil stones is another one that will cause bad breath. Allergies, that's usually tied back to an airway issue. And if all of those are negative, then I'll send them to a GI doctor after that. But I read somewhere a study like 90 to 95% of bad breath is coming from the mouth, actually.
Yeah, I mean, that doesn't surprise me. I think something that you just mentioned there, and it links all the way to the beginning when you were talking about nitric oxide, okay, something that's quite an important one to talk about here, is mouth tape. Now, this has only come across my kind of eyesight in the last year, because I have a friend who is a world champion free diver, and I remember when I went to sleep next to her, when I went to go and stay with her, she was like, "Are you finished talking?" And I was like, "Yes." And she was like, "Okay, I'm going to put my mouth tape on." So she pops on her mouth tape, and I just looked at her to say, "Sorry, what? Why are we putting mouth tape on?" And then she was talking about nitric oxide, and now there's become this huge trend about people breathing through your nose and not through your mouth. So I thought this might be a really good time to actually talk about it. Is it better to breathe through your nose than your mouth? And if so, why? And is mouth tape beneficial?
Yeah. So 100%. Our noses are here for a reason, right? They're not just some appendage that is slapped onto our face for no reason. So our nose is meant for breathing. If you look into the anatomy of the nose, we have these turbinates. So we have these circles of turbinates, and we have billions of trillions, and I don't even know what's greater than trillions of cilia, which are these little hairs that are in our nose. And the whole point of air coming in through our nose is a filtration system. So the point of our nose is to filter the air that's coming into our body. So when it comes in, our nose is going to warm the air. The hairs and the turbinates are going to filter out all of the pollutants that are in the air. We also are going to get nitric oxide mixed in with the air when we breathe through our nose. And so then by the time that oxygen is getting to our body, we have increased amounts of oxygen, we have nitric oxide, we have clean air, no pollutants. We're taking out bacteria and viruses. So anything that we're putting in our body is clean. It's like our own air purifier, if you will. But what happens when we sleep at night, especially as we get older, we lose the tonicity of our muscles at night. And because of other issues, we could have big, large tongues, we could have small airways, whatever. People's mouths typically tend to drop open, and then we start breathing through our mouth. That is horrific for our health, because now we're breathing in through our mouth. So we're bypassing our air purification system. We're bypassing the production of nitric oxide. So we're breathing in dirty, polluted, infected air. We are not getting increased oxygen. We're not getting nitric oxide. So we're not getting that vasodilation. And so then people will start to develop chronic inflammation that will oftentimes manifest itself as allergies, postnasal drip. We're also drying out our mouths. So we're creating an acidic mouth, and we're disrupting our oral microbiome. So it causes a whole host of issues. And so, yes, critically important to breathe through our nose. That's why we have it. They're not the most attractive looking things, but they're there for a reason. And so if you mouth tape, you're kind of forcing yourself to breathe through your nose while you're sleeping.
Well, I read in the book, because I had a small section on ADHD, and ADHD is getting so much attention at the moment. But I thought it might be interesting, because you say that actually when you don't if you don't breathe properly, like through your nose when you're sleeping, your sympathetic, which is like your fight or flight system, turns on and couples with cortisol release, which is obviously like our stress hormone, makes you more hyperactive and unable to concentrate when you're awake. And many children might be misdiagnosed if they're breathing the wrong way with ADHD. Reading that kind of blew my mind.
Yeah, a lot of kids, unfortunately, are given, especially in the US, given medication to help them focus and sit still, when really most of the time it can be attributed back to airway issues. And so a lot of kids have issues with having small jaws. And so sometimes they'll have really big adenoids, or tonsils will be really big. And if you have really big tonsils in the back of your mouth, it's really hard for you to breathe. And so it could be an anatomy issue that their airway is being blocked. Oftentimes that's it. But you'll see kids, if you ever see a kid that is hyperactive, they get lots of chronic ear infections, lots of chronic sinus infections. And if you look at them and their teeth are ground down, they're super flat teeth, it's an airway issue. And oftentimes you address the airway issue, their chronic illnesses go away, and their attention issues go away.
So I'm now going to have to add to my Amazon order of a mouth tape.
Yeah.
The one thing I'm scared I'm going to rip it off in the middle of the night, though. I mean, I'm not the most restful sleeper.
Yep. And so, and you'll have to keep me posted on this, but oftentimes when you start mouth taping, you sleep a lot better. So I'll have a lot of people say, I get up frequently during the night. When I wake up in the morning, it looks like a tornado went off in my bedroom. That's usually airway issues. And so if you can mouth tape,
my Oura ring ends up on the other side of the room.
Yes. So you will rip off the mouth tape, but it's designed for that, because a lot of people will say, well, I'm afraid to mouth tape because I'm afraid I'm going to stop breathing while I'm sleeping and die. Well, they make the mouth tape easy enough to take off. And so if you're having difficulty breathing, you absolutely will take it off in the middle of the night. That's okay. I just leave a stack on my bed table. So if I wake up in the middle of the night and it's off, I just put another one back on and go right back to bed. So it's intentionally designed that way. So that way, you're not putting yourself in a dangerous situation.
Okay, I will be adding that to my shopping basket.
Important.
So I want to talk about what else we need to add to our shopping basket, because people are listening to all this information. They're probably like, okay, just get me to the tools and the things that I need to do. So I did a little bit of a poll, which I'm actually now going to open my phone and have a look on Instagram, because when I was reading through, there was lots of different things that you said, how often we should go and get our teeth cleaned, and there's different types of cleaning, and the toothbrush that we should use. So I asked online, first of all, I said, quick question today, team, as I'm doing a little bit of research for something that might be very helpful for you. Do you see a hygienist? And if so, how frequently? 42%, so most people, said no, never. Never seen a hygienist. And 17% said yes, once a year. 25% said yes, twice a year, and 17% said more than twice a year. So predominantly, most people have never seen a hygienist.
I'm actually really surprised by that.
Also, can we just mention that I have a very health conscious audience? So this isn't someone who is not into health and posting it to an audience. Everyone who listens to the show is into their health. So I found that really interesting. And then the second question I asked was, have you ever suffered with poor oral health, gum disease, cold sores, bad breath, fillings? 77% said yes, one or more has affected me.
Isn't that crazy? But yet 42% haven't been to the hygienist.
So let's just talk about, where did we start with our teeth, and how can we get our oral microbiome, it's a bit of a tongue twister, that, thriving?
Yeah, it is. So I would say first is find someone to do a test for you, or that can send a test to your house, because unless you know what's there, you don't know how to treat it. And what we know is that half of the bad pathogens in the mouth are resistant to cleaning alone. So sometimes you'll talk to people that say, yes, I go get my teeth cleaned 3 or 4 times a year, but I've always had bleeding gums. Well, that's because they're getting the wrong treatment for the type of bacteria in their mouth. Just like if you have a sore throat, you need to know if it's strep or if it's something else. That way, should I take antibiotics, or is this viral, and do I need to wait it out? So same thing with the oral microbiome. You must know what is there if you're going to get the right treatment. So first thing would be test. Second thing would be to go see your dentist or hygienist I always say minimum 3 times a year. The twice a year cleaning is a protocol that was set up by insurance companies. It was not set up based on science. It was set up based on insurance companies and their profit model. So we know that health will change in as little as 90 days. And specifically with our current environment and how we live, we are constantly under attack by bad foods, sugars, our environment. We talked about the LA fires before we started recording. All of those things are insults to our health. And so we know health can change in as little as 90 days. So waiting a year or even 6 months before getting intervened is much too long if you want to try and maintain health and prevent disease. The whole point here is prevent disease. So test first, go see your dentist or hygienist for cleanings 3 times a year, minimum. I like 4 if you can, especially if you live a high stress lifestyle or if you have any other systemic disease, you absolutely should be seeing your dentist 4 times a year. Your insurance will not cover a couple of those cleanings, but that's okay. $120 cleaning is much better than having a life of periodontal disease, especially after all the stats we listed off here. And then after that, there's things that you can do on your own at home to try and optimize and maintain health. We mentioned people should be brushing minimum twice a day for 2 minutes each time with an electric toothbrush. So something that plugs into the wall that charges that's what you need to be using. Now, it is true that if you are brushing properly with a manual toothbrush, it will be just as good as your electric toothbrush. However, I've done studies with Colgate where we tried to look at this, and even with an electric toothbrush, the average time that people brushed was just over a minute. So I can guarantee if someone's not using an electric toothbrush, they're not doing a very good job. So twice a day for 2 minutes each, but then you also must floss twice a day because remember our teeth have 5 surfaces and the 2 most important surfaces are the ones in between the teeth that the toothbrush does not get to. So if you brush and floss twice a day, you're almost there. Next is you need to scrape your tongue with a tongue scraper. Our tongues have their own microbiome and a lot of people talk about bad breath. Really key to clean that off with a tongue scraper. The microbiome of the tongue is different than what's on the teeth and gums. And so if you're using your toothbrush, which I did for decades, you're kind of cross-contaminating there. So use a specific tool for your tongue. And then make sure you're not using any products that have harsh chemicals or alcohol in them. I would say if you do that, you're 95% of the way there. And then if you want to throw on oral pro and prebiotics and some lozenges, you're really getting up to optimization.
So I just want to talk about a couple of things. One, I've heard a lot about like a morning routine of like swirling water around your mouth. Is that a good trick? And do we do it with mouthwash? Do we do it with just warm water? And I said to you before the show when we were talking in the newsletter, Compassionate Cure, I used to always buy mouthwash that used to like burn my mouth because I'd be like, it's great, it's going to like kill everything in my mouth. I'm going to have really hot, fresh breath. And then I read your book and thought, oh, I've just killed everything. I'm not actually doing something very good. So let's talk about that. Are we meant to have a morning routine of swishing water around or mouthwash around? And how should we be looking at what mouthwashes to buy?
Yeah. So we always want to try and be as gentle as possible. And so if something says kills 99.9% of bacteria, that's not good because and I did this, I told you as well, like we would make our mouthwash extra concentrated so that it would burn. But the commensal bacteria or the beneficial bacteria of our mouth are actually easier to kill than the bad pathogens. FN is really, really difficult to treat, for example. And so when you put harsh chemicals in your mouth, you're going to kill off the good stuff first. And then you'll kill off the bad stuff. And if anything survives, it's going to be the bad. And so you want to try and avoid things like killing off 99.9% of the bacteria, unless you do have a dysbiosis that has been diagnosed properly with a saliva test. Then we may purge your microbiome for a couple weeks and try and wipe it all out and then start again by rebuilding it with what should be there. But on average, no, don't kill it off during the day. In terms of is mouthwash beneficial? So, I would say it's not going to be the thing that gives you a robust microbiome unless, again, we're trying to correct something that is wrong. So swishing with water is great, for sure. What that's going to do is just kind of break up any last pieces of plaque or debris that's in there, and then you can spit it out in the sink. I like to freshen breath with mouthwash, so I'll use super gentle, non-toxic mouthwashes at the end of my morning routine just to kind of give me that extra bit of freshness after doing everything, and then I can kind of spit out any free-floating bacteria or plaque that are there. But no, mouthwashes do not make or break your oral health unless you're rinsing with scope or alcohol Listerine.
I also want to mention that, I'm glad that you mentioned that brand. I didn't want to say, I wasn't sure whether I was going to mention a brand, but you said obviously natural, but then I also read that essential oils can disrupt your oral microbiome. So I think we have to distinguish what is natural here, because people will say, oh, this is full of essential oils. It's all natural. It's got no fluoride in, which is nothing I want to talk to you about. And then you're telling me in the book that also disrupts the microbiome. So what should we be looking at when we're making these choices of toothpaste and mouthwash? What are the products?
Yeah, and there are, I'm pretty sure, but pretty sure Scope does. But Listerine, for example, makes a non-alcoholic mouthwash. So even they're getting more on the scope of alcohol-free now. But they do have other harmful chemicals that I'd be leery of. Yes, there are certain essential oils that can disrupt the oral microbiome. For example, tea tree oil is a really good antimicrobial essential oil, and a lot of people will rinse with tea tree oil. But again, you have to be really careful with that because that can disrupt the oral microbiome. So I would, it's okay to use essential oils if you want to freshen breath, for example, but I would stay away from anything that is considered antimicrobial or antibacterial essential oils. And so that's why a lot of people just choose to rinse with water now and not rinse with anything else. Another big one is coconut oil. A lot of people want to do oil pulling. I always tell people, if you are wanting to oil pull, to do it effectively, you really have to swish this around for about 15 minutes to get the effects of this. I can't even get people to brush and floss twice a day for 2 minutes each. So I'm let's forget about the oil pulling and just do the basics, right? There are some antimicrobial effects of oil pulling. There's anti-inflammatory effects. There's, really good fats that are in there that are great for our oral health. It's a really great lubricant. It can disrupt some of the bonding of restorations. So you got to be careful if you have a lot of fillings in your mouth, because it can affect that. But that shouldn't be your go-to thing for improving your oral health, right? Do everything else first.
So what about fluoride? Because there's this huge kind of conversation around fluoride, that fluoride's good, fluoride's bad. It's now being put into obviously tap water to help with reducing tooth decay, and there's a lot of uproar about these things. When we're looking at a toothpaste, my dentist will always say, use pro-enamel toothpaste, use Sensodyne, these type of things are very good for you. And then other people say, no, use fully natural toothpaste that's not got any fluoride in. Where should we be looking at when we come to toothpaste and products that we're buying for our teeth?
This is a really big topic of conversation in the US right now. I just came across something saying that Utah is pulling fluoride from their tap water. The EPA has come out, basically saying that there's been studies showing that fluoride exposure lowers IQ in children. So it's really a hot topic. And what I will say is that now we have some alternatives to fluoride that are safer, or that we think are safer based on the research that we have. And so people can use things like arginine. Arginine is a really potent desensitizing agent, and it also is really good for killing the bacteria in the mouth that cause cavities. So if you look at your Sensodyne or Pronamel, oftentimes they'll have really high levels of arginine in them. So arginine is great if you're trying to reduce sensitivity or prevent cavities. Another really good compound that you can look for is nanohydroxyapatite. It needs to be nano, because if you just use regular hydroxyapatite, those particles are too big to incorporate into the enamel to try and remineralize lesions. So in NASA, for example, NASA was who helped develop the nanohydroxyapatite compounds to help keep their astronauts safe in space. So if it's good enough for NASA, it's good enough for me. So toothpaste that have nanohydroxyapatite are going to be great, as well as arginine. I think the key thing here is we need to prevent decay and disease, because once decay passes through the enamel and gets into the second layer of tooth structure, which is dentin is alive. And dentin is connected directly to the pulp of our tooth, which is where the blood vessel and nerves are. And once it gets to dentin is really soft. And so it can progress very rapidly and get and infect the life force of the tooth, which is the pulp. And then that's when we get things like tooth infections and abscesses. And so that is much worse for our health than using a little bit of fluoride in toothpaste. So while there are better products on the market, and I would recommend them, I certainly would never tell a patient that has rampant decay or is high risk for cavities or who has fillings on every tooth, like you should go fluoride free, right? Because they're such high risk factors for having a systemic component to dental infection that I would say we need to fix your diet. We got to fix your lifestyle, your oral hygiene habits. We got to fix this decay. Let's get everything rebalanced, and then we can talk about going fluoride free. So I think the conversation is too focused on one thing and we're not really looking holistically at the issue. But yes, there are safer alternatives out there. But you got to look at the patient.
Well, I also think there's another area of toothpaste that we've not mentioned, which is whitening toothpaste, where I think there was a huge craze at one point where everyone was getting whitening toothpaste because obviously everybody wants whiter teeth. And you wrote in your book, titanium dioxide is in many toothpaste brands, which is mostly ones that have like the whitening in. Is that bad? Should we stay away from anything that's like severely trying to whiten our teeth? Is that going to like disrupt our microbiome?
It can disrupt the microbiome. Oftentimes what it is it's really abrasive to the teeth. And so people will say, I have really sensitive teeth. And I'll say, well, what toothpaste are you using? And they say that they use a whitening toothpaste. Well, those whitening toothpastes are just full of really abrasive, like titanium dioxide particles in there that as you're brushing, it's actually removing portions of your enamel. And when you remove your enamel is like a helmet to your tooth. It's a really hard, innate structure. It's harder than our bones, actually, which is interesting because people say, oh, I broke a tooth, and they act like it's no big deal. And I'm like, your teeth are the hardest substance in your body. If you're breaking your teeth, like your bones would be crushed. Let's back up and talk about that. But that's a whole nother thing. But yes, it can disrupt the microbiome, and it can also cause tooth sensitivity. So, but you also need to look at, it kind of depends, because if your teeth are dark because you're drinking coffee or tea or whatever, okay, sure, that's an appropriate time to use that. But other people will have lost enamel on their teeth because of aging or erosion or something like that. Once you lose your enamel is the only thing that can whiten. So if you've lost enamel on your teeth, the dentin, which is more gray and yellow, shows through. So the thinner your enamel gets, the more gray and yellow your teeth look. That will never whiten. So if you're using a whitened toothpaste to whiten thin enamel teeth or grayish teeth, gray teeth won't whiten.
Wow. And so I'm kind of coming to the end of this whole conversation and thinking there's a lot of people that get veneers, right? And you obviously, I don't know if anyone who's listening to this has seen what a veneer looks like, but they kind of chop half your teeth off, basically. They make them into small, rigid triangles and then pop them on top. Now I'm hearing about everything. Is that just destroying all of the goodness of keeping these teeth intact and actually going to make people that have veneers maybe have more severe health complications later down the line?
Yeah, so it's definitely a cosmetic procedure, right? It's like if you go get your nails done, you get fake nails. You're essentially putting a laminate on top of your nails, and you know that when you take those laminates off, your nails are damaged underneath. The difference in the mouth is we're not taking those laminates off, except for, maybe every 10 to 15 years, if that's the case. Now, I will say that there are ways to do veneers that are minimally invasive. So you're barely prepping the teeth, or sometimes you're not prepping the teeth at all, and you're just bonding these to the outside. So you're not really causing as much damage. There are people like myself, I have crowns on my front teeth because of an accident that I had when I was younger. And so all my teeth, I had to get root canals on my teeth. My teeth turned dark. And so there is this kind of psycho-emotional component, right, to not having a good smile. So I think there's a balance between health and also mental and emotional health, as well. So if it's something that's really keeping you from communicating, because I think Chanel says your smile is the most important thing that you wear, so even Chanel understands the importance of a good smile, and it's how we communicate and interact with people. So if you're not smiling, if you're more introverted, if you're kind of embarrassed of your teeth, I am all for getting a smile makeover or your teeth fixed, but done in the most conservative way possible to preserve the health of your teeth.
Amazing. And so lastly, to think about this as a full lifestyle intervention, I can't leave this without asking you something about food and diet. What are the foods that you think harm our oral microbiome the most, and which foods do you think kind of allow our microbiome to thrive the most?
Thriving foods, our oral microbiome loves plant-based foods. So and specifically fiber. So any type of fibrous foods, any fermented foods like kombucha, kimchi, kefir, our oral microbiome loves things like that. So if you want to help your oral microbiome, eat lots of plant-based foods, lots of fibers. That's
also going to help your gut microbiome. You're winning
same.
On both ends.
Shocking, right? Now our teeth, I will say that our teeth loves, if you're trying to improve your teeth or reduce cavities and things like that we're looking at more animal-based stuff. So high quality grass-fed organic animal products, dairy, grass-fed butter, lots of vitamin A, vitamin K, things like that. Calcium, vitamin D3 are good for the teeth. In terms of things that destroy our oral microbiome is going to be sugars. Oral microbiome, the bad pathogens love sugar, which sugar is horrible for our body. And so what's bad for our body is bad for our teeth. Also, another thing that people don't realize are going to be highly processed carbohydrates. So things like crackers, pretzels, anything that after you eat it kind of sticks to the side of your teeth and you kind of have to use your tongue, right, to kind of clean off your teeth. That's horrible for your oral microbiome. And it's almost worse than sugar, because oftentimes sugar, you'll eat and you'll swallow whatever that is. But anything that's kind of sticky and sticks to the teeth from processed food just is a haven for the bad bacteria to go eat those substrates and proliferate and cause a lot of damage. And then the last thing is going to be obviously super acidic drinks. So sodas, which we've known forever, are going to be horrible for our microbiome. Wine is because alcohol is, right? So I hate to say that because I love wine. But yeah, anything with alcohol is going to kill the oral microbiome.
Okay. Well, we've really got a roadmap for our oral microbiome. And what I love about this is so much of it is connected similarly to what we do for our gut microbiome. I really hope that listeners feel inspired to get a hygienist to check up 3 to 4 times a year, to get an electric toothbrush, to floss, to do all of these things, even swirling water around our mouth just to kind of get that saliva. And also maybe even speak to their dentist. The one thing that I've got from this is that I'm going to have a conversation with my dentist about highlighting this issue that so much of us don't know about. And actually, I guess they're going to be the leaders to take this on. So maybe also encourage people, if they've listened to this, to share this episode with a dentist or their dentist.
Yeah, absolutely.
To hopefully get the word out. So, Katie, the last question I always ask to my guests is, what does live well, be well mean to you?
For me, and kind of where I'm at on my journey right now, live well, be well is accepting and acknowledging my intuition as the place that I need to be standing in. In the past, so often I have had a really strong intuition, but done otherwise. And when I'm out of alignment with my true north, my center, that's when I'm most unwell, whether it's diet, mental health, emotional health, physical health. And so I'm trying to listen for my intuition to talk to me and follow that.
Wow, I love that. Intuition is so powerful, but so often overlooked. So thank you for sharing that. Thank you so much for coming on and just giving us a whole wealth of information around the oral microbiome. Please, can you just share your book so people I know will want to order this?
Yeah. So the book I wrote is called Saved by the Mouth. It's an homage to Saved by the Bell, which is what I grew up with. It's a really cheeky, fun read. I think I tried to make oral health as conversational and fun as possible. So every chapter is a different organ system in the body and how the mouth relates to that. And I tell a specific patient story of someone I had in my practice that we were able to treat their mouth and how it improved their systemic health.
Yeah, I absolutely loved it. And actually, I know we've spoken about, types of products to buy, but you've literally got them all listed in there because I've gone and bought them all. So I'm going to let you know how I get on with them. I'll report back to the listeners on how I get on with it. And thank you so much for all the time and the effort to get this, conversation out there. And again, for me, like the most important thing is that we see the mind and the body as a system that all works together and not in silos. And that's exactly what we're doing with the oral microbiome. So yeah, thank you so much for the work that
Thanks
you're
for having
doing.
me.